Hello TMJ Disorder sufferers, this is Simon the Shiatsu Guy here again with my quick tips series. These particular videos are our self-care tips for your temporal mandibular joint. This particular one is from Alexander Technique, which is a kind of relearning of the way we use our bodies. According to Mr. Alexander, that we have lots of misuse. So we're, instead of lifting up, we're kind of pulling down, for example, and a lot of counterintuitive movements. We think we're pushing up, or we're letting ourselves lift up, but actually we're pulling. We may be pulling this way. Okay, Alexander Technique is a very big topic, a big subject. I've been working with the teacher for about 2 years, and I feel like I'm just getting it. So this isn't going to give you very much, but a simple technique, and this is to release and stretch this ligament here that's sort of at the top of the jaw. This is called the whispered R technique, and the idea is that while keeping an upright posture, we let the jaw kind of fall forwards, and that helps stretch this ligament so that the jaw's not kind of squashed up into the TMJ and into the ear and into the temples. Sorry. So quite simply, take a deep breath in. Let the jaw open forward, and you're going to say ah. And it's not ha, but ah. I was warned by my teacher that I would get it wrong, and apparently I did, because I pulled back and pulled the jaw up instead of letting it come down. So it's a very gentle, quite subtle movement. So I did ha instead of ah. So it's very subtle, apparently it makes a difference. Yeah, but it's about this releasing away, and apparently the whispered R is helping somehow. I think it's the vocalization. I'm not an expert or even anything with Alexander Technique. I've just done some and I have found it useful, although kind of confusing sometimes. But yeah, let's try it again. Kind of has a relaxing effect. I would guess you can practice this several times a day as well. It feels a little bit similar to the opening and leaving the gap and breathing, but I think there's a little bit maybe less tension in it, so more moving down and away. So have a play, see if it feels helpful, useful. It might just feel completely confusing and counterintuitive, but give it a go. Alright, until the next time, give it a try.